COVID-19 pandemic update. Last week, we announced, as I'm sure many people know, the easing of some of the orders and restrictions that had been in place, particularly the ones that had been in place over the last month and a bit as we learned more about Omicron. And we continue to see that things are leveling off, although we are still, of course, having challenges in some areas of the province. Our progress, though, remains on track, and we are continuing to see this steady decline, and these are positive and encouraging trends. And as you know, we have committed to reviewing things in the next few weeks with the goal of removing additional measures as soon as we possibly can. And another important and positive note today, our management strategy, as you know, is supported by a number of vaccine and treatment options, some of which have become new, and we anticipated that there'll be new both vaccine and treatment options to come in the weeks and months ahead. However, we do know that last week Health Canada approved for use a new class of vaccinations, one called Novavax. This will be available in BC in the next few weeks. We don't have it has not yet arrived, but we are expecting to have it in British Columbia in the next week to 10 days. And I think this is really good news. This is an important new, different class of vaccinations. It is what we call a protein subunit vaccine. It's another option for people who require immunization who've not yet been vaccinated and need it for work, or for people who are healthcare workers, for example, for people who have had a reaction to an mRNA vaccine. This is a perfectly good and valid option to make up those doses that you need to get full protection. This is an interesting vaccine. It's one we've been watching for some time, and it's no human-derived materials were involved in its development. It uses an insect cell line, which is really cool, a moth cell line, and it also has an adjuvant that's made out of soap bark tree extract. So it is plant-based as well in part of it. And what it does, how it's different from the mRNA vaccines, they give the genetic code for the spike protein of the SARS coronavirus 2 virus, and your body then generates those proteins. In this case, the proteins are the virus, baculovirus is used, and it generates proteins that are then purified from these moth cells, and the proteins are put together with this matrix made out of the soap bark tree extract, and so you're given the proteins directly, and those stimulate your own immune system to develop antibodies, both antibodies and cell-mediated immunity against those proteins. So this is a more traditional type of vaccine. We have a number of other vaccines that use similar protein subunit technology, including some of the influenza vaccines, hepatitis B and zoster. So it's a tried and true methodology of making vaccines, and we know the immune system responds well. The data that we've seen that Health Canada has approved show it's very efficacious as well. So the efficacy in the trials is upwards of 90% in preventing infection. So this is great news. And another really important thing, it's a fridge-stable vaccine, so we don't have all of those issues that we had in terms of needing to have ultra-low temperature freezers, etc. We will, like the one-dose Johnson & Johnson, the viral vector vaccines, it will be available primarily through pharmacies and some of our health authority clinics. But if you are interested in the Novavax vaccine, the best thing you can do is call right now our COVID line, the COVID-19 vaccine line. So that's 1-833-838-2323, and tell the people that you're interested in getting the Novavax vaccine. What we'll do is make sure we have your contact information, and when the vaccine is available, your dose will be reserved for you in either a pharmacy or a clinic close to where you live, and you'll be able to get that as soon as it comes in. So I think this is fantastic. It's another really important tool that we have now in our toolbox that's going to get us through both this Omicron wave, but is also going to get us through what comes next. Because we know that the importance of the protection that we get from vaccination is one of those things that has made sure that we can get through this. For those who've not yet booked your booster shot, I strongly encourage you to book your appointment at your local pharmacy in particular as soon as possible. As more and more people have been vaccinated, our demand in our large clinics is ramping down. And so the COVID-19 clinics will be focusing, the health authority clinics will continue to focus on the 5 to 11 immunizations particularly, because we know there's important things that we need to have in those clinics to support families and children. But adults can get any of our available vaccines at local pharmacies. In addition to additional vaccine options, we also have, as we talked about 2 weeks ago, an additional treatment called Paxlovid that is now available, and we have got a little bit more supply in the province, in addition to Sotrovimab, which is a monoclonal antibody. And there are additional monoclonal antibody treatments that are approved for use and are going to be available in Canada in the future. These are especially important for people who are at high risk of having severe illness and hospitalization if they get COVID. And particularly it includes people who are older, people who have immune compromising conditions, and for those people, we know you as clinically extremely vulnerable. You've got those notes. We made sure that you got your vaccines early, but we do know that some people, even with 3 doses of vaccine, even with a booster dose, don't have as strong an immune response, and so these treatments are available now for you. They're also important for people who are not yet fully vaccinated, and people, especially if you're over 60 or you have other underlying illnesses. So these are a positive step forward, but as we talked about as well, like all medications, they're not suitable for everyone. In particular, Paxlovid has a number of interactions with a number of medications that people may be taking. So to receive either of these, you have to have a positive COVID test and a PCR or rapid antigen test, and we are prioritizing people who may need these treatments to be able to get PCR tests. And the treatments need to be started within the first few days, the first 5 days in particular of your symptom onset. So today, we have had access through infectious disease physicians in different parts of the province, and I want to thank them for the work that they've been doing. But we are also now setting up a self-screening tool that is now available and our call support center, so that people across the province can determine if this is a treatment that would be right for you and how you can access it. So to request treatment, and we'll send the link around, there'll be a 4-step self-screening tool that you can go online and find out if this is either of these are treatments that might be suitable for you, and a virtual assessment service that will now be available through the province's COVID-19 Information Centre around the province. So we'll be sending out the links to those information and posting them on our COVID-19 websites and on the BC CDC website. These are important to help prevent severe illness. But it is also a reminder that the most important thing we can do is preventing getting sick in the first place. And that, of course, means vaccination. It is our most important tool, particularly for older people, for people who have reasons that make them clinically extremely vulnerable to COVID. We know, and we've presented these data, that 2 doses remains very, very effective at preventing severe illness, even 8 months, 10 months later. And we know now from data from the BC CDC, from data that's been collected as well in Quebec and other parts of the world, that booster dose makes a difference. It makes a difference in boosting that prevention for severe illness and hospitalization, but it also prevents transmission. And it's about 60%, 70% effective of preventing any symptoms at all. And in Quebec, they looked as well, it's about 80% effective. If you get that booster dose, it reduces your risk of needing to go to an emergency department because of symptoms because of COVID. So we do now have good, strong data that tells us with Omicron that getting that booster dose is important. It prevents you from getting sick at all. It prevents transmission, and it prevents illness. So please, if you've not yet, if you've been invited, it's been 6 months, go out and get that booster shot. And if you have concerns because of a reaction perhaps to your second dose of the mRNA vaccines, it is an option to get Novavax as a booster dose, depending on what other vaccines you've had initially. If you've not yet had your first or second dose, even if particularly if you're a young person, 5 to 11, please talk to your pediatrician, talk to your pharmacist about the importance of protecting young people from illness as well. We still have a lot of this virus that's circulating, and this protection is good, strong, safe protection and long-lasting, and it will help us for what we're dealing with now, but also as we're going through this transition phase and into the future. Testing, of course, continues to be part of our ongoing efforts, and last week it was shared that we finally have received quite a lot of the at-home tests that are available for people. These are rapid tests that can be used by people at home, and they'll be distributed. They've already started through schools throughout the province, and the tests will soon be able to we'll also be distributing them to people based on their risk, which of course means age, and I'll leave it to the minister to give details of that. But I want to just remind people that these tests are a tool that helps you determine what activities you can do if you have symptoms. That's when they are best used. And I've talked about this before. They're a red light and not a green light. So if you have symptoms and you want to know if you need to know if they're COVID, then these rapid tests are a really great way of doing that. And then you need to isolate until you're 5 days or until you're better. If you don't have symptoms, if you have symptoms and you test negative, it doesn't mean that all of those other measures that we have in place right now you can ignore. It means that you need to continue taking care, making sure that you're staying away from others until your symptoms resolve. As more tests arrive in BC, we'll be able to expand our availability to even more people, and I will refer people to the BC CDC, and we'll put links again on guidance on how they are best used to support your decision making for you and for your family in the coming weeks and months. We are also transitioning to what will be our sustainable COVID-19 management strategies we've talked about, and we've been focusing on effective response, recovery, and then readiness for what lies ahead. This means we will be continuing things like our whole genome sequencing surveillance, and I know there's been a lot of concern about potential variants, about variants like the BA.2, the Omicron variant that is increasing in transmission in some countries around the world, like Denmark and the UK. We have seen that here in BC, and more in different parts of the province. It is increasing, but slowly here in British Columbia, and we'll continue to monitor that. We've also been monitoring things like the Delta Omicron variant that has been causing a few clusters, particularly the UK and Australia. We've not yet seen any of those mixed variants here in BC, but our whole genome sequencing program is designed to detect those, and we will continue to look for these. We will also continue to expand our surveillance streams using such things that we've done periodically, like serosurveys, to help us understand how much immunity is in the community. We are in the process of expanding the wastewater surveillance that has proven to be so helpful as yet another marker that helps us understand what's happening. And continuing to monitor things like the PCR test positivity rates, geographic rates of disease and outbreaks and illness. Each step of the way, as we move through this next few weeks, we'll be making our decisions about lifting restrictions, about lifting mandates and orders based on what we are seeing here, where we're seeing transmission, and the data that we have about our pandemic here in British Columbia. And as you know, we are at a different pace, at a different place in our pandemic than many other parts of the world and the country. It is important to remember that while our cases are coming down, COVID-19 is still actively circulating. And I know many people who have children know that we're seeing it in young people, in schools, associated with some schools. We're also seeing it in communities around the province in different ways. We also have seen, tragically, that we still are seeing people dying from COVID-19. Most of them are people who have underlying illnesses, people who are older. However, in the last few days, we've had 4 people in their 40s who've died from COVID-19. That's important. It reminds us that everybody has risk. Right now, we still have high levels of transmission, and if you don't have the protection that vaccine gives you, there is a possibility of having more severe illness and ending up in hospital. So I encourage anybody who's not yet taken that move to think about Novavax as an option right now. Keeping our COVID safety basics are just important today, if not more so than they were last week, as we've started to get back to many of those activities and social activities that we've missed over the last month or so. So I ask that you please be respectful of others as we go through this transition. We can and should all go at our own pace, at our own comfort levels. We need to make sure that we are wearing masks where it's appropriate for us, keeping our distance from people, particularly if we have people in our family, in our community, in our workplace who are vulnerable to more severe illness. It's about moving slowly and gradually in the one-way direction only, so that we don't have to have a turning back of the dial. This means all of us continuing as we've been doing in BC to be accountable to each other, to manage our own risks, and equally important, be mindful and respectful of the risks of those around us. This is our long-term sustainable strategy that will get us through this transition period and help us deal with what comes next. As Omicron fades and as we see what comes next in this pandemic, these are the things that will get us through. And on today, on Pink Shirt Day, I remind us that lifting each other up is important, and it is how we will get through this pandemic together, and continue to remind us to do that and to remind us to be kind with each other. Thank you.
Thank you very much, Dr. Henry. Today I'll provide an update on BC's rapid test inventory and updates on healthcare workers off sick last week and surgical postponements. And we have a slide deck which will be available to the public and members of the media after the presentation that describes the rapid antigen test distribution strategy, and we'll go through that now. I'm going to get some help. The inventory summary, first of all, we've been reporting this week to week, and this is as of February the 22nd, 2022, or yesterday. BC has received 22,242,902 tests. We've deployed 14,843,222 tests, and that leaves 7,399,683 tests in inventory. We're expecting approximately, and this depends on our distribution, when we receive them from the federal government, approximately 3 million tests per week in the coming 4 weeks for 12 million tests. Reminding you that about 558,000 of these tests are not suitable for home use, and although those tests will be continued to be used by public health to support, particularly in dealing with clusters of cases. So if we go on to the next slide, which is not the last week, but this brings us up to February 22nd. You'll see that over the last week, compared to last week, we distributed a further 4.83 million tests around BC. In the last week, 3.3 million of them went to K-12 schools or post-secondary institutions, and another 418,000 were distributed to other population channels, primarily long-term care and assisted living. And a number of tests, about 865,000, have been pre-positioned for community tests distribution by pharmacies, and I'll get to that later. You'll see on this slide, if we go back to the slide, that we see the overall distribution of tests, which is 12,838,020 since December 13th, 2 million prior to that, and that the largest number so far have gone to education, to long-term care, to healthcare workers, and to COVID testing sites, but they've also gone to rural, remote, and Indigenous communities, to childcare facilities, and most recently to pharmacy distributors. So that's where the rapid tests have gone. Distribution this week, we'll continue to focus in on those. So all of those priority areas that we've talked about will continue to be replenished as tests are used, whether it be long-term care or remote communities or others. We're now, of course, expanding that strategy regarding rapid antigen tests. What we're going to do is make tests availability easier for people and get them into the hands of more people for their use when they're symptomatic. And Dr. Henry talked about that in her presentation. The next slide. So here are the new approaches. No, that's all right. We got the new approaches to it because, as you can see, the priorities have been the priorities we laid out over the last number of whiles. You've seen the distribution of those priorities. As sufficient numbers of rapid tests have come into place, we're developing new approaches, and you're seeing that in evidence this last week and this week. Previously, we focused on priority high-risk populations. Last week, we announced additional distribution through schools, K-12 and post-secondary, with the important shift of tests now being taken home for use at home by the student and their families if they were to become symptomatic. As we announced last week, that's 5.9 million tests. We're going to go to that purpose, essentially 5 per student. That process has begun, of course, to happen, and you saw a very significant number of those tests distributed last week. This week, we're adding community distribution channels through community pharmacy to make more tests accessible to the full population. So the next slide. What's the same? What's the same is that we're continuing, the focus remains on using the test for when an individual is symptomatic. Focus remains on striving to have tests available, particularly for those who are most at risk. That is, those who are susceptible to severe illness and death from COVID-19, those individuals where testing is clinically indicated, where a positive result would impact treatment or care, individuals who live or work in settings with others who are high risk for severe illness. High-risk individuals continue to be encouraged to seek a PCR test if they are symptomatic. And what is new, we're increasing test availability through existing channels of distribution, and we're creating new channels, such as pharmacies. Increased test availability means more members of the general public will be able to access tests to use to understand their own symptoms and illness and take action to limit transmission to their friends, family, and work, including those at higher risk. And so this is what we've done in the last week. As you see, the distribution update shows that in the last week we've seen this distribution of tests. We'll move on. I spoke about that earlier. And so what's new is the pharmacy distribution. That pharmacies will distribute a rapid antigen test containing 5 tests through this additional channel to interested individuals. There will be no cost to citizens for these tests. More than 865,000 have already been prepositioned to a pharmacy distributor from which pharmacies can order and receive stocks. Kits will start being available for pickup at select pharmacies as early as Friday, and it is expected that the number of locations will grow rapidly with time and supply. Please check, and there will be a website at the BC Pharmacy Association for a list of pharmacies that are dispensing tests. How will it work? Well, for starters, we're going to use the same approach we've taken throughout the pandemic and focus in on those who are most at risk to severe outcomes from COVID-19. And that means, in particular, those over 70. So that's where we're going to start. Distribution will start for those 70 and over, who are amongst the highest risk, as we know. And so in the initial period, you'll need to be 70 or over to get access to these tests. Once distribution has started and supply grows, a broadening to younger ages will essentially go down the age ladder as we have previously. Broadening to younger ages is expected to happen quickly and will be communicated via our government COVID-19 website. Individuals will present their BC Services card at the pharmacy and will be given their test kit free of charge. To ensure as many people as possible have access, there will be a limit of 1 kit per person within a 28-day period. You can pick up a kit for a family member, another person. You must provide their name, date of birth, and have their BC Services card with you. And so that's what we're going to do. We're going to be starting for all those at the beginning, over 70, and then moving down the age brackets. This will assist in distribution, in particular, assist those who are most vulnerable to get access to rapid tests. So what do you do if you have a positive test? Dr. Henry has talked about that. There's full instructions on the BC CDC website. I encourage you to go there. And there's 4 things you can do. Report your test at reportcovidresults.bccdc.ca, self-isolate, manage your symptoms, notify your close contacts. And finally, going forward, as more tests arrive and as supply and capacity allows, we'll be providing greater access to all BC citizens. Increased test availability means more members of the general public will be able to access tests to use to understand their own symptoms and illness. So what we've done from the beginning, as we laid out in our plan on December 21st, is prioritize the people most at risk. And the first millions of tests as they arrive were prioritized for that reason. Now we have more tests. And first, last week, out to schools and post-secondary institutions, K-12 schools and post-secondary institutions. And starting the end of this week, through community pharmacies to people in the community, starting with those over 70. And as I say, as more tests arrive, we'll be able to lower the age groups who are eligible to get tests. With respect to our second issue today, the impact of sickness on healthcare workers, we saw a decrease in the number of staff with short-term illness, 14,579 during the week of February 14th to 20th. That's down from the previous week, which reported 15,524 healthcare workers off sick. That's 3,127 in Fraser Health, 2,840 in Interior Health, 1,510 in Northern Health, 1,478 in the Provincial Health Services Authority, 2,044 in Vancouver Coastal Health, 3,018 in Island Health, and 562 in Providence Healthcare. Remember, this is off sick for all reasons, and it continues to be higher than previous periods and previous equivalent periods, say February in previous years, but it has significantly come down. As you know, 2 weeks ago and 3 weeks ago, it was between 17 and 18,000, and now it's down under 15,000 to 14,579. Health authorities with respect to surgeries report that 6,070 surgeries were completed from January 23rd to January 29th. From February 13th to 19th, health authorities postponed 288 non-urgent scheduled surgeries. That's 6 in Fraser Health, 4 in Northern Health, 270 in Interior Health, 6 in Island Health, 2 in the Provincial Health Services Authority. No surgeries were postponed in the Vancouver Coastal Health Authority. Cumulatively, from September 5th, 2021 to February 19, 2022, regional surges of COVID and factors including severe weather patterns have caused 7,925 surgical postponements. As you can see, this was primarily and continues to be primarily an issue in the Interior Health Authority. Our staff there is working flat out to support patients. We are continuing to deliver urgent scheduled surgeries and emergent surgeries in the Interior Health Authority, and we will be making efforts, continued efforts to support that health authority as it deals with the impact of the COVID-19 pandemic. On May 7, 2020, we made a surgical renewal commitment to patients. We said we'd do 3 things. We said we would deliver surgeries that were postponed because of the pandemic. We said we would schedule and deliver surgeries that were not scheduled because of the pandemic. And we said we would change the way we deliver surgeries to get more patients their surgeries faster. As we've reported in weekly updates since then, despite what COVID-19 and severe weather have done to the challenge of achieving these goals, we have done what we said we would do, and we continue to deliver on our commitment. As we reported last week, patients whose surgeries were postponed in this 5th wave have started to get their calls to rebook their surgeries. Patients whose surgeries were postponed in this 5th wave have started to receive their surgeries. Innovations to increase surgical capacity were launched in every health authority across our surgical sites, benefiting everyone in need of surgeries. We will complete the postponed surgeries. We will continue to increase surgeries, and we will improve access far beyond what the pandemic has set us back. Our commitment to change the way surgeries are delivered in BC, that's our commitment, and that is what we are doing, and that is what we're going to continue to do. The patients in all health authorities are getting calls to rebook their surgeries is in large measure because of the work we're all doing, all of us are doing, to stop the current surge. And those calls will continue to occur and will increase in direct proportion to all the actions we continue to take to stop COVID spread. Our work makes all the difference. Your work makes all the difference. And for that reason, our work is not done. And with that, we're happy to take your questions.